Prostate cancer is the second leading cause of cancer deaths among men in the United States, with hundreds of thousands diagnosed every year. Last year alone, over 30,000 men died from it. Dr. David Samadi joins us now to talk about this.
Well, prostate cancer, as you mentioned, it remains a very serious health hazard. And that's one of the purposes of programs like this, to bring more awareness, especially in the month of September. Look, what's important is that the word cancer always makes everyone very nervous. But with prostate cancer, it gives us a little time to be able to do the right thing for them. So this is common among African Americans with 3-to-1 ratio. As you get older, the risk of prostate cancer becomes higher. If you have a family history of prostate cancer, brother or father, you want to really be aware of this and make sure you do screening. There has been a lot of debate about screening, prostate screening, what age, how often, etc. But the bottom line is you get the baseline at the age of 40, and if everything is normal, you can start again at the age of 45 every year after that. It's a simple test. You visit your doctor, and it's always good to get a second and third opinion if there's any doubt about it. And that's really, really important.
So it's always going to be proactive about it, but you have another technique out there for actually helping people, and that's using robotics. Tell us about that.
I think when men are diagnosed with prostate cancer, it gets very confusing. They read a lot about all options, whether it's radiations, whether it's surgery. One of the main options that we have right now is robotic surgery, which means that you remove the entire prostate, you have a chance of cure, but then you recover the quality of life. This smart technique that we're talking about, and there's a lot of information online on smart-surgery.com, is using the robotic technology and saving all the nerves that are responsible for sexual function, as well as the quality of life, which is the urinary control, which is most men and their spouses would be affected by this. So we have come a long way. This is the robotic surgery in the operating room, Jamie, and this surgery usually takes about an hour and a half. Unlike other options, like I said, you remove the prostate, patients have a chance of being cured, and always reserve the right for radiation after surgery if it's necessary.
Okay.
So we are going for the cure, we're going for the quality of life. We want to make sure that we preserve their sex life, the urinary control, and we've come a long way in the last decade or so. And that's really the great news.
And if you go the traditional route, which is, of course, to use radiation first, get in there and use that, what does that do to the patient?
Well, I think radiation is really not healthy for normal tissue. It may go after the cancer cell, but it can damage the surrounding tissues. But I'm glad that you brought this up, because once you get this radiation and the cancer comes back, it would be very difficult to do surgery after radiation. And that's very important information that we want people to know. Over time, radiation can affect urinary symptoms, can affect the sex life. So always make sure that you talk to multiple doctors and get all of your facts and information.
Is that scar tissue?
That's exactly what it is.
Surgically. So, Doc, you want the women who are caring for men who have prostate cancer, because I learned a long time ago doing these medical segments, ladies, you don't have a prostate, so no worries. But what can you do for the guys?
Well, I think women play a very important role over here. They make 70% of the decisions when it comes to this. It's a team effort, because this can affect both men and women. They need to read about this, make sure that you are aware of all the options, get multiple consultations. And as you said, prostate cancer does not have to be a death sentence. There are many options. It's not the robot that does the surgery, it's the experience of the surgeon. Look for centers that are dedicated to this modality and this disease, and you should do just fine.
Ask how many cases they do a year, folks. It should be a pretty good number.
Excellent question.
Thanks,
I love the fact that you brought that up, especially talking about African-American men not getting the PSAs that they should. Why does that happen?
You know, they're scared, they're afraid, but the good news is that this year, I can tell you, in our center, just one day alone, we had over 250 men that came in. We just need to educate more people out there, and we hope that everyone is listening to this segment and benefiting.
Dr. David Samadi, we thank you. So valuable, so valuable. Thank you.